relationship are to empower clients through facilitating self-reflection and creativity in problem solving and healing while establishing an accountability relationship within a candid and respectful communication environment. Ms. Rouse, USMA class of '84, is a U.S. Army Lieutenant Colonel retired with an extensive knowledge of the military ethos and as a federal civil servant, understands the environment and challenges of the federal workforce. Ms. Rouse has earned a Bachelor's of Science degree in engineering from the United States Military Academy at West Point in 1984, a Master of Science degree in Public Administration from Central Michigan University in 1996, a Master of Arts in Counseling from Liberty University in 2013, and completed ABD studies in Applied Management and Decision Science from Walden University. Ms. Rouse earned her federal internal coach certification in 2016 and is certified in sex therapy and education. The title of Beverly's talk is Sex Therapy, Reclaiming Physical Intimacy. Beverly, the floor is yours.
Thank you. I am going to share my slides. Oh Lord, what did I do with them? Okay, it's going to take a wrong. Wait, hold on. I apologize. I did something I should not have done. Okay, sorry. My apologies. Okay, let me get them up there. All right. So, welcome everybody. Thanks, Kristen, for the nutrition information. I learned a lot. For those of you who I've presented to before, who've heard my talk about before about sex therapy, I'm just going to go briefly through that, but we're talking today about reclaiming your physical intimacy. So we're going to talk about what is abuse, what's trauma, and how we can move forward from that. So a sex therapist, what is a sex therapist? Basically, a sex therapist is a licensed mental health professional who is specialized in treating clients with sexual issues. What does that mean for you? That just means that we can talk about what your sexual concerns are, and a sex therapist is more comfortable sometimes than your regular clinician in talking about sexual challenges and sexual issues. Oh, come on. Okay, so if we talk about sex therapy versus traditional therapy, like I said before, traditional therapists may not be comfortable talking about details with regard to sex. They may kind of overlook it or just not even ask a question. If you're in a traditional therapy relationship, your therapist should be asking you questions about sex. If you're in a couples therapy situation, your therapist should be asking you about sex. A lot of times, many of the traumas that we experience, whether they were sexual trauma or other trauma, affects our sexual well-being. The biggest thing is that sex is not supposed to be uncomfortable, but sometimes it is. And sometimes there's a medical reason for that, but we need to understand what that is. Many times our thinking and our feeling about sex is because we've had inaccurate sex education. And that's from both the male and the female perspective. And it's also from what people see on social media. It's from, just the things that you see on television and like different shows and stuff like that. So there's just inaccurate information out there about sex. There'd be medical challenges that affect your sexual experience, be it, and then healing from sexual trauma. So if you're experiencing challenges sexually, you're not alone. 43% of women and 31% of men report some degree of sexual dysfunction. Many of the issues presented have either emotional or physical contributing factor. Therefore, we not only do therapy, but we also provide education. Many of the medications we take can cause some sexual dysfunction, especially if you're on an antidepressant. medication, some birth control medications, some medications for like ADHD, any type of medication that affects your brain could potentially affect your sexual function. And then there's 1 in 3 girls and 1 in 4 boys who experience a sexually traumatizing event before the age of 18, which can contribute to sexual challenges. And when I say sexually traumatizing, what this means is that were you chased home from school because you were overly developed? That was me. Were you exposed to porn before you're ready to deal with it? That happens a lot. Were you touched? Were you experimenting? Did something happen that you were not able to control? And those are things that can affect how you are challenged sexually and what your experiences could be. What a sex therapist can do to help you is if you need some kind of assist in communicating this sexual dissatisfaction with your partner. If sex becomes vanilla or the relationship is in conflict, monogamy versus non-monogamy counseling. Sometimes a traditional therapist may be uncomfortable talking to you about the challenges with monogamy or non-monogamy sexual behaviors and things like that. Sexual therapists are trained to do that. And then any kind of sexual behavior that is what we call out of control sexual behavior. That it's not saying that maybe you like something that I don't like. What it's saying is that what you're practicing is out of control. You're doing it to excess. So those are some things that a sex therapist can help you with. What you can expect in sex therapy. So number 1, professional dialogue using accurate terminology. People have like little cute words for their vagina or for their penis, and we ain't using cute words to discuss your anatomy. We are going to talk with accurate terminology. You should expect safety. If you feel uncomfortable, you're going to feel uncomfortable because it's hard sometimes to start talking about sex per se. It's also difficult if you've been if you're an assault survivor to actually disclose that sometimes within therapy. And sometimes, especially like if you're going to the VA, you may have to talk to 3 or 4 people before you get the right therapist that's your person, right? And it's hard to actually kind of talk about that so many daggone different times. So that's challenging, but you want to feel safe with your clinician. We're going to go through your sexual history, your health today, your education, like what you were taught, what was your origin of your sex education, what's your family of origin? Is there a religion, trauma, and or abuse within that? Some people who've been raised in very strict religious environments suffer when it then comes to, then they've been sexually assaulted or they've experienced a sexual traumatizing situation and they just don't know how to talk about it. Or I just don't know how to talk about sex, period, because nobody talked about it when we were growing up. So I just don't know, sexual orientation. What's your sex assigned at birth? What's your gender identity? And then what's your gender expression? Because those may be different. Desire. Are you a low desire sex partner or are you a high desire sex partner? We don't say this is bad because a lot of times if you're a low desire partner, we just have to talk about, why you're a low desire partner or, what's affecting your desire and where's that going? We also want to talk about your expectation and the goals of therapy. Is it behavior change? Is it something going on in a relationship? Is it how you communicate about it? What is it that you need? And then we'll also, how do you know when to end the therapy? If it's a therapist mismatch, look, we're not working well together. Okay. I have had clients who've said I've been too direct, even though I tell them up front, we're going to be very direct and use accurate terminology. I had a client that said she was very uncomfortable talking about having penetrative sex. And I'm like, okay, well, how are we going to make this change? So, and then when you have your goals achieved, when your goals are achieved, if you've identified this is what I need to do as far as therapy is concerned, I've met my goal, then we can end this relationship. But usually your therapist is still open if you still need support after the fixed time period. Let's talk about sexual abuse. Sexual abuse is any behavior, attitude, or verbal response that hinders normal sexual development, bringing distortion and inhibition to the personal sexuality and lovemaking. So this can include, it doesn't have to be physical. It can be what you've heard or witnessed. That's when I was saying that, maybe you overheard conversations. Maybe you walked in on your parents and you're like, oh, Lord, what did I just see? That's not necessarily abuse, but it could be a trauma experience. Suggestive remarks. And, in the military, we're like, is that a toxic work environment? Is that sexual harassment? This is usually sexual harassment, the suggestive remarks. Witnessing overly intimate or non-intimate relationships, not no intimate. Some people are a little too touchy-feely, and that can overstimulate children or overstimulate folks who witness that. Some people don't touch at all. And this can also be a challenge if you grew up in an environment where you never saw your parents kiss, or you never saw your parents just get a hug or dance together or anything like that. Being watched while bathing or getting dressed. There are some people who have been watched and they can't control that. That's the challenge, right? Exposure of genitals, touching or rubbing up against a child. That's abuse or trauma. Being exposed to sex play either with adults or other children. That is abuse. The bottom line is that when your sexuality gets confusing and boundaries on relationships are blurred. Many times if you have been abused as a child, this is where you're not sure of your gender identity. And abuse can happen. You can be abused by a woman and you can be abused by a man. So this is where the lines have been blurred. The perpetrator is getting some type of personal sexual gratification in an inappropriate way. What this means is that the perpetrator basically is getting off on watching you be uncomfortable, or this is how they, get their jollies or whatever. The bottom line, though, is that abuse is a situation where you have lost control over how you decide what that sexual interaction is going to be. You were not allowed to give consent. Bottom line. Now, the effects on the survivor. Sometimes the rules and the sexual limits are distorted. I don't know what the rules are anymore. As a child, there's knowledge that something's wrong, but you're powerless. You feel helpless. You can't stop the abusive behavior. Many times as a child, when this happens, it's because the abuser has threatened your safety net. It's threatened your parents. It's threatened your family in some kind of way. We get very controlling of our environments because there's a fear of being out of control because the abuser took that control away. Many times we don't learn to set boundaries in a way that protect us. There's confusion about true and healthy sexual relationship. There's an inability to express or acknowledge your needs. Or there's an inability to believe that you deserve to have your needs met. There's shame and guilt about not being able to stop the behavior. This is seen a lot in survivors of child sexual abuse and survivors of date rape. There's shame around not being able to stop the person. And remember, this is also about consent. There's a lack of trust around feelings. I don't trust myself. There's earlier sexualization and then promiscuous behaviors. There's a failure to be able to feel love, joy, and pleasure. It's because you've blocked those things because you feel they're bad. There's flashbacks and triggers, and there's doubt about your sexual attractiveness because why did they bother me? Or you dampen your sexual attractiveness. You try not to be your best sexual person because you feel like, well, if I dress a certain way, that's why I was attacked. And if you think about it, in the 80s and the 90s, that was the accusation. If you were accused someone of rape, it was like, well, what were you wearing? And this is something that was happening constantly. The victim was accused of being sexually attractive to the perpetrator. And it's like, wait a second, I didn't give consent. So those are some things that are effects of the abuse. Let's talk about healing. How can the survivor can help your partner? So this is where sometimes it gets a little tricky because we don't know how soon to disclose we've been an assault survivor to our partners. So we have to talk about what your personal needs and feelings are, and yet your partner still has personal needs and feelings. You want to place the responsibility for the abuse on the abuser. And this is kind of when you get triggered about something. It's not your partner, it's the abuser. Sometimes we focus that anger or that fear and that anxiety on our partners instead of on the abuser. You also want to be intentional while trying to work through your anxiety. When you have disclosed that you are a sexual assault survivor, and if you are struggling with getting your sexual health back, you want to let your therapist know. Number one, you want to be in therapy, but you need to let your therapist know what your challenges are. Like you want to get back into having a healthy sexual relationship, or you want to get back to just having sex, period, or you want to get back and enjoying sex. Sometimes it's not about having sex because we can have it, but we want to enjoy it. We want to encourage your partner to get some support. Your partner probably needs to go to therapy or occasionally maybe go to join you in therapy. And then affirm your commitment to the relationship. Let your partner know that you are there with them. You want to be in this relationship with them, and that you trust that you're in this relationship with them for a reason. And then how your partner can help you. Your partner can be gentle and empathic. Oh wow, that's a spelling error. Sometimes when you read your own slides, you can't see it. And we want to resist placing sexual pressure. So you want your as the partner in this relationship, you want to resist placing pressure on the person who was the abuse survivor, because this is something you want, and maybe they don't want it at the time. That's why I say, we have to discuss low desire versus high desire, and we have to talk about what that looks like for your partner. Learn to touch in a non-sexual way. One of the things we do with couples a lot of times is start out, especially those who come in with sexual challenges, is to start out with non-sexual touch, holding hands. You'd be surprised how many couples don't hold hands. We don't communicate. We don't talk. You talk maybe for 35 minutes a week if you're in a couple relationship about something serious. Most of our chats are about vanilla kind of things, what's going on with kids, blah, blah, blah. And if you don't have kids, you may talk 20 minutes a week. I don't know. Provide a safe space. And when I say provide a safe space, that means your partner who is the abuse survivor needs to have the opportunity to be able to say no. Because if I have permission to say no, I have permission to say yes. And I also have to be able to trust you. I have to be able to trust you with my feelings. I have to be able to trust that you are going to hold me when I tell you I need to be held in a safe way, or we've established what our trigger plan is. And I have to feel that you're going to honor those things that we've talked about. You need our partners to be supportive on our journey and recognize that our journey is going to be up and down. We're going to have good days. We're going to have bad days. Empower your partner to and complement their strengths and abilities. Give them the opportunity to make choices about how they want to be seen in the sexual relationship, how they want sex today, how they want things to go this week. And recognize, I may say this today, and then tomorrow I may feel a totally different way. So you keep the lines of communication open. And your partner has to remember, you did not choose to become a victim. And remember when I said your partner needs to provide a safe space, what that safe space is not accusing you because of the abuse. Because once somebody accuses you and says, oh, it was your fault that you were abused, that's not a safe space anymore. They're not a safe person for you anymore. So that's something that has to be specifically discussed. As we talk about reclaiming your sexuality, remember every person's journey is different. What works for me may not work for you, may not work for your friend, may not work for the person down the street. Every person's journey is different. Every survivor's, just like every assault, every trauma is different. We ask that you find a professional counselor. Seek the help, because when it feels scary and painful, you need help to confront it. Sometimes it's better to go into a group support, or you may have to be hospitalized if your trauma or abuse was so significant that it is keeping you from living your everyday life. Don't be scared of it. Prepare for a journey. It's going to be a rocky road. Like I said before, some days are going to be good, some days are not going to be good. You're going to learn how to set healthy boundaries for all relationships, because sometimes the abuse has happened by a family member. And so you don't know how to set boundaries within family, because maybe you were told, oh, go hug granddaddy. And granddaddy was the one abusing you. Oh, go hug Aunt Susan. And she was the one abusing you. And we force our children to hug. And it's like, no, if your child's telling you they don't want to hug that person, give them the freedom not to. That's a choice. And we have to honor choices. And that's what setting healthy boundaries is about. We have to resolve and understand our feelings of anger, rage, pain, fear, and shame. Says these feelings have to be confronted and understood in order to let go and heal. I still get angry. I think that's the thing that we have. No one is saying that you have to forget, or, oh, forgive this person. Oh, or you shouldn't be angry and it's been over 40 years or over so many years. Why can't I be angry about the fact that this person took my choice away from me? However, what we want to do is understand where these feelings are coming from, and then how do we learn to heal from them? What I really want all of you to know today is that it said, break the conspiracy of silence. However, this is your choice. You decide how you choose to break the silence and the secrecy around your particular abuse, trauma, harassment, whatever. You choose. If you choose to say nothing, it is okay. If you choose to go to therapy and you say to your therapist, I don't want my accuser to be, I don't want to identify my accuser, my abuser. This is the one thing I want to caution you on. If you speak the name of the abuser and the abuse happened prior to you turning 18, it is the therapist's legal and ethical responsibility to report. So if you don't want your abuser identified, just say my abuser. A lot of times we get comfortable with our therapist and we may forget. Just say my abuser. But it is your choice, unless you, because that is our therapy, that's our therapeutic ethic, is that we have to report, and your therapist needs to share that with you. I have to report these things. I have to report if abuse happens to someone who's over the age of 65. I have to report if abuse happens to anyone under the age of 18. So that is my ethical responsibility. So if you name the person, I don't care if you're 50, 60 years old, and you say, XYZ abused me when I was 10. I got to report XYZ. But if you say the abuse happened when I was 10, and if your therapist pushes you to identify that person's name, I'm not going to say that's a bad therapist. I'm just going to tell you right now, you do not have to do that. Okay? Be strategic as you make this decision, especially if it involves a confrontation of the abuser, because you have to understand that your purpose for doing this is for your healing and your healing alone, and that you are not re-victimized in the telling of your story. I do not want you all to go into therapy, share all this information, and then feel like, oh, I'm empowered, I can go confront my abuser. And you're not given the tools to help you manage what's going to happen. Your therapist should prepare you. If you're going to confront the abuser, this is things that could happen in your family after you do this. These are the things that could happen in your career if you do this. These are the things you need to be aware of. So before you make that choice, you need to know what you are capable of handling and when you're ready. And your therapist should be there to support you in that process. Get comfortable as you recondition your mindset around sex. The challenge here is sometimes when we've been victims of sexual abuse, depending on what happened, we just may be uncomfortable with sex as a whole. We might be uncomfortable with certain positions. We might be uncomfortable with lighting. It could be anything. But those are some things that we're gonna have to work on reconditioning your mind around. Don't discount your feelings or reactions when you're triggered. You want to, I don't think I put this on here, you want to develop a trigger plan with your partner. And so that when something happens in your trigger, you know what to do to help calm yourself and how to move forward in that space. You're going to try to learn some healthy behaviors and some self-talk, meditation, to control your physical response. Oh, Lord, boy, I was working. How to ground yourself in the present, and how to allow your partner to assist you. Sometimes you may just need to take a walk, right? And sometimes that walk will have to be, and I'm going to walk for 20 minutes and I'm going to get this much exercise. Sometimes you need to just go out and walk, and maybe go out and walk in the rain. Or if the rain is a trigger, go out and walk in the sunshine. Go out and walk and just like, okay, I'm just going to notice everything I smell. I'm going to notice everything that what do I see that's different on this particular walk? But with no goal in mind, just go for a walk. Try not to duplicate the past. What that means is, let's not go back and start reliving this happened. Oh, and nor don't put what happened to you in the past on your partner, on your kids. Like, you can't do this because this and this is going to happen. What we want to do is teach healthy behaviors about and healthy boundaries to our children, especially because this can happen and it can come up when you're a sexual assault survivor, especially if you also experienced some sexual trauma as a child. I don't want my kid doing this. I don't want my kid doing that. And then you hear all the stories. Oh, this happened at summer camp. Oh, this happened over here. Or this happened there. These are some things that you need to be aware of, and we need to prepare our children about how to live in the world and what to do. So there's that. Go ahead, Alita. I'm sorry.
We have 1 more minute. Thank you so much.
Thanks. And I'm almost done. So engage in pleasurable touching, non-sexual holding before genital stimulation. So what that means is get comfortable with just touching each other, and a non-sexual hold. That means give me a hug, hold my hand. It doesn't always have to be, sexual satisfaction doesn't always have to be penetration or orgasm. That's not the goal sometimes. And then as we age, not the goal. Sometimes it's just, how do I get myself stimulated so I can enjoy and have a pleasurable experience? And finally, I just want you to stay courageous and stay present on your healing journey, because many times when we can stay focused on what's happening to me in the here and now, it'll help you to move forward as far as your healing journey is concerned. And then these are some different resources. This YouTube thing about consent, it's a cute little video. It's a nice one to share with your children, especially if you have teenagers, because it talks about tea and how we enjoy tea. The book Come As You Are by Emily Nagoski is a nice one to just to talk about, read together with your partner as far as like what happens when you have blocks or things like that with regard to sex. Finding your sexual voice, and then a website, omgyes.com, is a nice website to talk about how women can pleasure, and to help you to get comfortable with pleasuring yourself if that's not something comfortable for you, but also to help you and your partner have a discussion about, oh, okay, well, maybe that's what's going on there, and things like that. So those are some different resources that we have for you all. And that's the end of our presentation.
Beverly, we have one question in the chat so far. Does the VA